So guys, here is our vlogging. Kaya nakalimutan ko paano mag-vlogging.
Hello guys, welcome back to another dose. My name is Noor.
I'm Cha. I'm Rochelle. And I'm Kuli. And in today's video, we will be doing suctioning.
So why do we do suctioning? The procedure is performed to remove secretions to promote airway patency. There are two suctioning procedures we will demonstrate today. So for the first procedure, we need to know the following terms. The endotracheal tube, acronym ETT, is an airway catheter inserted into the trachea via the mouth or nose in endotracheal intubation. Endotracheal intubation is the placement of a tube into the trachea in order to maintain an open airway in patients who are unable to breathe on their own or maintain their own airway. ETT suction is the process of applying a negative pressure to the distal ETT or trachea by introducing a suction catheter to clear excess or abnormal secretion. For the second procedure, we have an oropharyngeal suction, which is the process of inserting a section catheter through the mouth to clear secretions. For nasopharyngeal suction, the tube is inserted into the trachea. So again, for our first procedure, we have ETT suctioning. ETT suctioning is performed for the following indications: bradycardia, tachycardia, absent or decreased chest movement, visible secretions in ETT, increased ETT carbon dioxide or transcutaneous dioxide, irritability, blood pressure fluctuations, coarse or decreased breath sounds, an increased work of breathing, or recent history of large amounts of thick secretion. The equipment we need for this procedure are surgical gloves, a catheter, and a ventilator. Before the procedure, we must perform proper hand hygiene and don sterile gloves. Remember to explain the procedure to the client and what they should expect. Now, on to the procedure.
Now let's begin with the actual procedure of endotracheal tube suctioning. Adjust ventilator settings to pre-suctioning baseline if settings have been adjusted when indicated by stabilization of patient's oxygen saturation and heart rate. Explain procedure if client is conscious. Good morning, I am Nurse Noor, and I will be the one to perform suctioning into your trachea via mouth. A tracheal tube is a catheter that is inserted into your trachea for the primary purpose of establishing and maintaining a patent airway by clearing secretions and to ensure the adequate exchange of oxygen and carbon dioxide. Place client in supine position. Assemble equipment. Perform hand hygiene. Pre-oxygenate or ventilate the client. If with vomitus or food debris present, no bagging. Check oxygenation status. Wear sterile gloves. Approximate length of catheter to be inserted. Measure from the center of the lips to the earlobe and then to the nipple line, approximately at the level of the carina. Keep catheter sterile during measurement by coiling tube to your gloved hand. In case of pulmonary edema, your partner should hyperventilate the client prior to suctioning. If with food debris or vomitus, suction directly. Do not hyperventilate. With your gloved dominant hand, Place the soft catheter into the endotracheal tube without applying suction. Advance catheter slowly down into the desired length or area. Suction catheter should not exceed tip of the endotracheal tube. Place dominant hand-thumb on the hard plastic hole at the proximal end of the catheter and apply suction. Slowly withdraw catheter using rotating motion. Dip catheter in sterile water to clean or remove thick secretions or debris. When setting down the catheter, maintain aseptic or sterile technique if catheter is to be used again. Hyperventilate client and repeat the procedure PRN or as needed. Reset ventilator. Perform hand hygiene and aftercare.
Effectiveness of the ETT suction. We assess for improvement in the patient's breath sounds, improvement in oxygen saturation, transcutaneous carbon dioxide, the heart rate, blood pressure, and respiratory rate. And we also assess the removal of secretions, as well as a decreased work of breathing and improved chest movement. Now we move on to the second procedure, which is the oropharyngeal and nasopharyngeal suctioning. For this suctioning, the equipment we need are non-sterile gloves, mask, a sterile basin, clean towels, a suction machine, connection tubing, a suction tip, and water. Once again, before the procedure, we must perform proper hand hygiene and don gloves. A mask is necessary for protection against the possibility of body fluid splash to occur. And now onto the demonstration of the procedure.
We need to assess the patient's need for suctioning by observing signs of hypoxia. We should also assess any risk for aspiration and inability to protect their own airway or clear their own secretions adequately, since this may lead to upper airway obstruction. Good morning, I am Nurse Charisse. Please state your name and date of birth. Okay, so now we will be doing oral suctioning. This will help clear out your secretions from your throat. And if you feel the need to cough, you may do so. Perform hand hygiene and apply non-sterile gloves. Position patient in a semi-fowler's position with the head turned to the side. This will facilitate ease of suctioning. Place a towel on the patient's chest. For unconscious patients, they should be in the lateral position. Gather supplies. We fill a basin or container with water. Remember to use different suction tips to each of the orifices. A different suctioning tip for the ET, nose, and the mouth. Turn on suction to the required level. We can test the function by covering the hole on the suction tip with your thumb and suctioning up a small amount of water. And remove patient's oxygen mask if present. If suctioning through the mouth, nasal prongs may be left in place. If suctioning through the nose, then the oxygen mask must be removed. Insert suction tip and apply suction by covering the thumb hole. Run the catheter along the gum line to the pharynx in a circular motion. Keep suctioning tip moving and encourage the patient to cough. If required, replace oxygen on patient and clear out suction catheter by placing suction tip in the basin of water. Also reassess respiratory status and the oxygen saturation for improvements. Call for help or notify the physician if any abnormal signs and symptoms appear. Ensure patient is in a comfortable position and call bell is within reach. We provide oral hygiene if it is required. Then we clean up supplies, remove gloves, and wash hands. Document procedure according to the hospital policy. We should document the respiratory rate, lung sounds, how the patient tolerated the procedure, and the color and consistency of the secretions. We may reassess the patient's status after an hour.
Thank you for watching. Wow, hindi niyo siya makita. We will zoom in. What can you say to our viewers?
A special message. guys, shy sila.
Please take a picture. I will just do that to us. Like, I know. What's the spot? Learn a lot.
Lima kami sa procedure. Galing sa kabinet.
Open your mouth. Open. One, two, three, go. Ah! Grabe.